Hello, everyone. On behalf of the Hamilton FASD Collaborative and the Hamilton FASD Resource Team, I want to welcome you all to today's webinar entitled FASD Snapshot: Information, Interventions, and Best Practices. This is one of 3 webinars that the Hamilton FASD Resource Team is putting on for our community. As a collaborative, we are very excited to be presenting these webinars to you and hope to be doing much more of this throughout the coming year. We have 4 members of the Hamilton FASD Resource Team presenting to you today. And at this time, we're going to take a moment and introduce ourselves to you. My name is Enrico Di Gian Domenico. In my professional career, I worked for 35 years in the child welfare system and have been a part of the Hamilton FASD Collaborative and the Hamilton FASD Resource Team since its inception in 2009. Since retiring in 2019, I've continued to be a part of the Hamilton FASD Collaborative and the Resource Team, and have started a private practice providing education, case consultations, training, and support in the area of FASD.
Hello, my name is Lori Dickey, and I too am a member of the FASD Resource Team. I've been with the team for about 4 to 5 years. And I also have an opportunity to work in the community of Hamilton.
Hi, I'm Stefania Martelli. I'm a member of the resource team, and I've been a member for about 2 years, and I work in the Hamilton community.
Hello, my name is Fiona Kupel. I am also part of the resource team and work in the Hamilton community.
All righty, so if we have a look at the agenda, what we're going to be looking at today is talk a little bit about what is FASD. We're going to look at the prevalence of FASD. We're going to have a look at FASD across the lifespan. And then we are going to look at some of the best practice ideas, some of the things that we know work when supporting someone with FASD. I'm going to tell you a little bit about our Hamilton FASD Collaborative to start. FASD is a unique disability that requires unique supports and interventions. The Hamilton community recognized the need for education, outreach, and training for caregivers and service providers who support people with confirmed or suspected FASD. The Hamilton Collaborative was formed to meet this need. In fact, 25 different organizations within the Hamilton area came together in 2006 to form this collaborative. The Hamilton FASD Collaborative is a group of service providers dedicated to supporting and growing awareness about FASD. It has representation from child protection, education, adult developmental services, substance use, Indigenous community, mental health, and criminal justice system. Our Hamilton FASD Resource Team is a part of the collaborative. We have all received specialized FASD training. And some of the services that we provide are community education training, in-service training to any organization that wants to learn a little bit more about FASD. And I think the thing that we provide, which is most helpful, are individual case conferences, which is where we get together with the support team for an individual with FASD for about an hour and a half, and we hear a little bit about the individual, listen to some of the strengths and some of the challenges that the individual has, and do some best practicing and training and make some best practice recommendations. These services are available to families, caregivers, and service providers that support people with confirmed or suspected FASD.
So in looking at prevalence in Canada, can FASD base their prevalence rates on a Toronto study done in 2017 on young school-age children. And it estimates that the prevalence rate in Canada to be around 4%. But because we know of the invisibility of the disability, it's likely that these stats are an underestimate of its true prevalence. We know that in Canada, it affects more people than autism, cerebral palsy, and Down syndrome combined. So what is FASD? Fetal alcohol spectrum disorder is a diagnostic term used to describe impacts on the brain and body of individuals prenatally exposed to alcohol. What we know is that alcohol crosses the placenta during pregnancy and causes damage to the brain. It is a lifelong disability in that we know that it causes organic permanent brain damage. It's a brain-based disability or a disability of thinking. It's often referred to as a spectrum disorder because it varies in how it impacts each individual with FASD. We know that it can have lifelong physical, cognitive, and emotional disabilities. But we also know that each individual living with FASD is unique and has both strengths and challenges. A baby's brain develops throughout the entire pregnancy. So to protect a baby's brain, it's best to avoid alcohol the entire pregnancy. The fact is that there is no safe amount of alcohol in pregnancy. There are lots of campaigns out there today that promote greater education and understanding of the impact of alcohol, as well as planning for a healthy pregnancy. Research shows that women don't seek to harm their unborn child when drinking. Sometimes there is an unawareness of the pregnancy. There may be addiction issues or mental health challenges or abusive partners that are pressuring them to drink. So supporting women and partners to avoid alcohol during pregnancy is so helpful. So here you'll see on the diagnostic terms. On the left-hand side, you see the current Canadian guidelines. On the right-hand side are those guidelines that were used prior to 2016 when the new terminology was developed. FASD with sentinel features, what we know is there, in order to have features, we know that there's confirmed prenatal alcohol exposure, as well as a confirmation that 3 or more brain domains is impacted. And those 10 brain functionings or domains we'll talk a little bit more in the next slide about. When we talk about sentinel features, we're referring to the small eye openings, as well as that flatter groove between the nose and upper lip, as well as having a thin upper lip. FASD without sentinel facial features, again, is confirmation of prenatal alcohol exposure, as well as 3 or more brain domains being impacted. And at risk of neurodevelopmental disorder and FASD is where we have confirmation of prenatal alcohol exposure, but it might be too early to have confirmation that 3 or more brain domains is being impacted. So the primary disabilities are what an individual with an FASD is born with that's caused by the damage to the brain from the alcohol use. It's not something that goes away, but it is something that can be supported. The 10 areas of functioning here are assessed through diagnostic testing, and they are often referred to as the 10 brain domains affected by FASD. We know that alcohol affects the growth and formation of the brain, and we often see that through an individual's behavior and development in these various areas. So adverse life outcomes, also known as secondary disabilities, are the negative life experiences that can result when an individual with an FASD is not provided with adequate supports. It's not an absolute that this will happen, but we know that there's a more likelihood when they're not supported well that they could experience adverse outcomes. So if you're seeing these type of outcomes, it could prompt you to consider that there might be more going on here for that individual. In a study that looked specifically at adverse outcomes, what we saw was that 90% experienced mental health problems. The most common are depression and anxiety, and we do see an early onset of that in adolescence. 60% had trouble with the law. What we know is that individuals living with an FASD don't typically understand the relationship between their actions and possible consequences. We know that they can be socially vulnerable and they can be easily taken advantage of. And so they often become followers and kind of do as their friends ask. They often also struggle with making the same mistake repeatedly. So we also have 50% experience confinement. We know that sometimes the issues lead them to needing support through inpatient treatment or due to criminal involvement, they might end up incarcerated. 50% of the group had been reported for repeated inappropriate sexual behavior. This is typically a result of poor social skills and a lack of understanding around society norms. They struggle with reading people's cues, and they can misinterpret a person being friendly towards them. 60% had a disrupted school experience. They typically struggle in school if modifications or accommodations are not put in place for them. They might respond with inappropriate behaviors towards those frustrations at school, which can result in a disruption such as a suspension or expulsion. So it's very important for us to understand their functioning and to provide programming to help them be successful. 30% also experience problems with alcohol and other drug use. Again, because they're typically followers, they might get involved with particular friends who are associated with drugs and alcohol. They may not understand the harmful effects of alcohol and drugs, and so they might get led down the wrong path. This slide here is a great older study. It's been repeated and replicated several times. What you see here is the profile of an 18-year-old chronologically. And on the right-hand side, you see a list of different areas of functioning and understanding. And alongside each of those, you see a number that really reflects how developmentally the individual at 18 is functioning. What we know is that we have expectations of adults. And individuals with an FASD will present in some ways very like any typical adults, but in other ways they might not. When we see an adult behaving in a way that's not congruent with their physical age, it causes us maybe to impact negatively how we interact with them or respond to them. And so this is a great example of the difference between a person's developmental functioning and their chronological age. With individuals living with an FASD, we really need to focus more on where they are functioning developmentally than necessarily their chronological age. There are going to be areas where they are neurotypical, but then there's also going to be areas that we really need to be cognizant of in terms of their developmental delay in order to support them well. We also need to understand that in adulthood, maturity levels tend to level off. And so in other words, we may not see a significant difference in an individual living with an FASD as they get older in age.
We are now going to review some of the possible challenges experienced in different stages of development. In infancy, you may see delays in meeting milestones such as crawling and walking. Babies can often be irritable, so crying a lot or unable to settle easily. They could have eating difficulties such as poor suck reflex, sensory issues, difficulty establishing routines, so those sleep patterns that are really important. No stranger anxiety, so we'll go to any strangers without any fear, and often mistaken as failure to thrive. So weight gain or rate of gain is below that of other infants. In childhood, some difficulties that were present in infancy continue to be present. There can be difficulties with executive functioning that become more pronounced. The gap between the individual and their same aged peers becomes more noticeable. Some other challenges can include being impulsive, difficulty with change and social skills, behavioral problems and learning difficulties, issues with sleep, lack of fear, stranger anxiety, struggles to learn from consequences. They can be accident prone or need a high level of supervision, and they can struggle making simple choices. We tend to see the biggest gap in academics between their peers by grade 3 because curriculum becomes more abstract. When it comes to adolescents, they are developmentally delayed by 4 to 10 years. Their primary and adverse outcomes become more noticeable. There can be faulty logic and poor judgment, and they can be egocentric, so they don't recognize the impact of their actions on you, and they can be easily manipulated by older, often negative peers. I'm going to read an example for you with regards to how a youth can be easily manipulated. So a youth was meeting with his community worker and telling his worker that he had a girlfriend, but when asked, he couldn't remember her name. The next day, the youth met with his girlfriend at Tim Hortons, and while sitting there, they noticed a man get up to go to the bathroom, leaving his laptop behind. The youth's girlfriend noted that she would really like a laptop, so the youth got up and took the laptop from the table and gave it to the girl. She immediately left the coffee shop, leaving the youth behind. When the man came from the bathroom and inquired about his laptop, patrons of the restaurant noticed that the youth was the one who took it. The police became involved, and he was the one who ended up getting in trouble. He couldn't describe who his girlfriend was to the police. That's just an example of someone taking advantage of a youth, but the youth was taking the fall without understanding where he went wrong in this situation by taking the laptop. Continuing with adolescents, adolescents can have trouble internalizing modeled behaviors. They can benefit from ongoing support with respect to managing time, money, relationships, and also hygiene. They often do not learn from experience. They can have difficulties managing social media safely and appropriately. So we see lots of youth accessing inappropriate sites and then getting in trouble. And it's really important in adolescence to be positive role models for these youth and to model behaviors for them so that they can learn. In terms of adults, we often see many of the same behaviors and challenges previously listed with a few additions. When unsupported, there may be difficulty maintaining employment and housing. They give the appearance of being unmotivated or lazy at times. They can have lack of follow-through and poor memory skills. They can be disorganized, lack self-direction, control, and discipline. Transitioning to adulthood can be difficult. Why? Because they have left their structured environment, like school, and expectations have been increased for them.
The number one protective factor, and probably the most important thing that we can provide for an individual with FASD, is a stable placement, both at home, at school, and in their employment. And by stability, we mean that we want the sameness in the rules, the expectations on the individual, the physical environment, the people around them, their routine, their structure, and their habits. If we can provide all of these for an individual with FASD, that is how they will find the best success as they go through life. This slide here looks at traditional interventions versus how we should provide FASD interventions to an individual with this disability. In traditional interventions, we typically start out by making a connection with the individual that we're going to be working with. We get to know them, we get to know what their likes are, what they don't like to do, we get them to feel comfortable with us. Once they're feeling comfortable with us, then they will listen to us. They'll begin to be compliant with us. And once they're compliant with us, then we can build on their competencies. That's when we can start doing some of the teachings that we want to do for them. When working with an individual with FASD, it's really important to start with their strengths. One of the hallmark features of individuals with FASD is we know that they struggle with their self-esteem. So what we want to do is have them perform tasks that we know that they will be successful in. This way, their self-esteem builds up, they feel good about themselves. Once they feel good about themselves and are confident in their abilities, then they will begin to work with us, and that's when we can develop our relationship with them and continue to build on those teachings. So focusing on strengths is probably the area that we want to start with when starting to work with an individual with FASD. When I first started in the area of FASD, I know one of the things that we all did was wanted to hear about some of the areas of struggle and start attacking those areas right away And oftentimes we forget to ask about the strengths of these individuals. But we know that people with FASD have many strengths. Again, we always seem to get caught up in their behaviors, and we forget to ask about their strengths. And a really important strategy that we oftentimes use is to make sure that we provide them with one positive experience a day where they can use their strengths. And that way it keeps their self-esteem in a positive area. So for example, if they are musically inclined, then they include a choir practice or a music class or a practice session in the home as part of their daily routine. If they like to organize things, then have something ready for them to organize when they get home from school or work. Basically, we're looking at their strengths and, again, wanting them to feel confident and competent so that we give them an example of a strength-based activity every single day in their life. The 8 magic keys. I think these next 8 points are a really good starting point as to the type of environment that we want to set up for an individual with FASD. The first thing we want to do is always be concrete. Talk in concrete words. Don't use words that have double meanings. And remember to always think of their developmental age rather than their chronological age. We know that individuals with FASD are very concrete and not abstract thinkers. So we want to be focused on their competencies. Be consistent. The fewer changes, the better. And the fewer changes means not just in the way we talk to them, in the way we approach them, but also in their environment, keeping their environment very stable. Talk the same way, give instructions the same way. Be consistent with the school also. This requires a lot of communication between us and the school. Repetition is also something that will really help resolve the memory issues that individuals with FASD typically have. We need to repeat things in the same way day after day in order for them to get it into their long-term memory. Daily routines are also really, really important. Doing the same stable routines in all of their environments that do not change from day to day are best for learning and lowering their anxiety. This is how they know what comes next and what to expect. And therefore it reduces, again, a lot of their behavioral issues and a lot of their anxiety. Keeping it simple. Again, keep the environment simple so that they don't get overstimulated or overwhelmed or easily distracted. And that goes for the same with the directions that we give when we ask them to do something. Keep them simple and basic and very concrete so they understand very clearly what we want them to do. Be specific. Say exactly what you mean. Again, individuals with FASD are not good with abstract, so it's very important that we speak very concretely to them. The structure is also very important. It helps with some of the executive functioning challenges. It basically, the structure is sort of like the hallways around them that keep them going in the right direction. That structure will help them get from point A to point B. And supervision, I think, is one of the things that I really recommend a lot. Appropriate supervision throughout their entire lifespan to ensure that they're able to be safe and remain safe from any harm.
What we know works. We know that role modeling through the use of coaching and mentoring is helpful for individuals with FASD. The important part about finding a coach or a mentor for someone with FASD is making sure that they understand FASD and know how to engage a youth or a child and consistently communicate with the others in their environment. One-to-one staff can be helpful, and role-playing healthy situations can be helpful. When we think about role-playing, what we want to do is we want to have them practice the role of the individual so they know what they're supposed to say and how they're supposed to react. Again, we need lots of practice and repetition. So we need to practice the same thing over and over so that, again, they get used to doing that. So people with FASD are often referred to as a 10-second person in a 1-second world. So they do need additional time to process. So us understanding that they need this helps us be more patient with them. And we also just need to keep reminding ourselves that they will need more time, and we want to remove time pressures when we can. So for example, a mom has 2 children, one has FASD and the other one is neurotypical. She's dropping them off at school. They're waiting in line to get out of the car. The neurotypical child gets his stuff, gets out of the car, says bye, is on his way. The individual affected with FASD is still gathering their water bottle, their bag, their seatbelt still on. They need lots of extra time to remember what they need to do before they get out of the car and lots of time to prepare. So it is helpful for us to give warnings and to let them know what to expect. And again, that consistency is helpful so they know that the routine is the same. So developmental age before chronological age, we already touched on this previously, but individuals with FASD often function lower than their chronological age. And again, the functioning might not be even. There might be some areas in which they're managing really well and low in other areas. So this is considered to be one of the hallmarks of FASD. As one ages increases, so do the social expectations of autonomy and independence, which makes it harder for those individuals with FASD. And so like what was already mentioned, when they get to adulthood, we kind of see them plateau. We don't see lots of big changes. They've kind of reached where they are able to learn cognitively or developmentally. So when we understand what an individual's level of functioning are, then we're able to support them at their level. And so their best chance of success is for us to understand how they're functioning and to support their environment for their individual needs. So just a kind of rule of thumb is to take the chronological age, divide it in half, and add a year. So this just kind of gives us an example of where they might be functioning. So just a quick rule to kind of remember if it's an individual that you're new to working with, that you just have a kind of a baseline. So again, taking the chronological age, dividing it in half, and adding a year. So this is a really good picture which describes how an individual's FASD's brain might work. And so individuals with FASD have lots of information in their brain. They're very intelligent, but they're not always able to access their information in the same way. So if we think of a normal filing cabinet and a neurotypical individual, they have lots of information in their brain. It's organized. When you need to remember something or know how to do something, it's easier for you to get that information in your brain and put it into practice. An individual with FASD has just as much information, maybe more, but they just struggle to organize it in the same way or struggle to retrieve it as quickly as they may need it. So success for individuals with FASD is always about the environment and not the individual. Traditional interventions give accountability back to the individual, and this fails. What we know is that individuals with FASD require lifelong and daily supports in order for them to be most successful. Their success comes from positive and supportive environments that we set up around them. So again, it's that importance of everybody being aware of FASD and understanding FASD and how it impacts that individual. So we know if we take supports away from individuals with FASD, we will see them struggle. So we need to try to keep those supports in place and wrap around them as long as we're able to. So another thing we need to remember is to focus on quality of life issues. We often get stuck wanting individuals to learn academic skills, but we forget about the things that they're going to need every day in life. So it's important that we create social and recreational activities for them and teach them to do skills such as making their bed, laundry, grocery shopping, those really practical skills that they're going to continue to need help with as they grow. Successful interdependence. So for individuals with FASD to be successful, they must learn to ask for and receive help. Educators and caregivers are key to the development of this skill. So what we want to do is we want to teach individuals how to ask for help. We want to reinforce and we want to praise them when they do ask for help, so they know that they develop this skill and they're able to do that in their future.
Promoting lifelong interventions. These are some of the things that we want to encourage for our individuals with FASD as they go through their lifespan, and some of the things that are significant for them. Diagnosis as early as possible. The earlier we can determine, the earlier we can establish that the disability that they are dealing with is fetal alcohol spectrum disorder, the easier it will be for us to put into place some of the best practice ideas that will help them throughout their lifetime. We always want to build upon their personal strengths and identify their talents and their skills. And it'll be these strengths that we utilize to help resolve some of the challenges that they have in their life. We want to assist them in learning how to be a friend. Because of the social discrepancy between their chronological age and their developmental age, they're not very good at being a good friend. So we want to encourage them through role playing and through social stories. We want to encourage them and teach them how to be a good friend. Assist them in how to behave in a socially appropriate manner. Again, because of some of the executive functioning difficulties that they will have throughout their lifespan, oftentimes we need to spend a few moments and prepare them for different social events that they're going into. So for instance, a day at the mall, before we all get out of the car and go into the mall, we might want to take a minute and just review some of the rules while we are in a mall. Help the person learn to be alone and find constructive solitary things to do. Again, as the child and the young adults get older, we want them to be able to be comfortable spending some time alone together. We know that they need their support, and their support team will always be close. But while we have things to do, like get supper ready or get different things ready for them, we want them to be able to spend some time on their own, doing something, reading or playing or taking on some kind of a task that they can do on their own for a while we get things ready. And then help the person learn to work and enjoy working. This will also help give them a positive experience as they get older, if they can find a part-time job, and help them to feel as if they are socially productive in the world today. What caregivers and service providers need. Training, and more training. As all of the members of our resource team will tell you, you can never have enough training in the area of FASD. Some of the best practice ideas that we recommend that we put into place are very normal, common sense things, but very different from how we raise a neurotypical child. So any opportunity that you have to have some more training in FASD, we would all recommend that you go ahead and take that. Coaching and mentoring is really, really important. Someone that you can call upon, and someone who can walk you through a situation and remind you that, yeah, that's FASD, and here are some of the things that we can do to help in this situation. Respite or relief are really, really important for the caregivers, and actually for professionals that are also working with an individual with FASD. Again, we heard that a stable placement is the most important thing that we can provide for someone with FASD. So we want to ensure that the caregivers, that all of the professional support team around that individual stays fresh and stays healthy and therefore to give them frequent breaks so that they can recoup and get ready for another time at looking after them. And grief and loss is really important for caregivers and professionals who are working with individuals with an FASD. It's a matter of accepting the disability for what it is and working with them to achieve the best that they can be for their life. Modify your home and program. If we were doing this in person, one of the questions we would ask you would be, based on the FASD information that you've received today, what would you need to do differently in order for your home or your program to be more FASD friendly? So something for you to think about as we're drawing to a close with this webinar.
Please reference on the last two slides the resources which are located on the FASD Collaborative website, info@fasdhamilton.ca, if you require supports and services.
So that is the end of our webinar. We hope that you've enjoyed this webinar, and we look forward to the next webinars that we send out to you all. Have a great day.